Good way.
All right, thank you so much. Yeah, so I appreciate the invitation, the chance to come and talk to you guys. I appreciate so many people taking time out of their Monday morning to come and listen and talk about this. I see a healthy number of folks logging in now. And so, really the presentation here has sort of two chapters to it. The first part, we're going to talk about gun violence exposure, how common it is, how that differs across different communities, and the impact that different types of gun violence exposure can have on mental health, particularly depressive symptoms and suicidal ideation. And then I'm going to pivot about halfway through and shift from gun violence exposure to firearm access and talk about how that also impacts the risk for suicide, in this case, death by suicide, and some of the tools we have available to prevent that outcome. I'm gonna give you a heads up. Most of my slides are in the form of visual abstracts. I like them a lot. So one of the reasons that motivated me to take my current position instead of the more traditional faculty role I had before is that I had an opportunity to really lean further into science communication. I don't like when science and data that has real implications for the well-being of communities gets sort of locked up in an ivory tower. And so my center takes that very seriously. And anytime we publish a paper, we make a visual abstract that summarizes the findings of the study. We also put out press releases and do videos and blogs and all sorts of other stuff like that. But the visual abstracts I find make useful slides. But visual abstracts, in this case, from slide to slide, will have more information than you need for the purpose of this specific talk. So don't worry about trying to consume all the information on any one particular study highlighted in a visual abstract. I'll pull that out and talk about it for you. But if you see one that you're interested in, you want to know more detail, all of them are available for free. And we're happy for you to download them and share them widely. You can get them off of the GVRC's website. So that's Gun Violence Research Center.rutgers.edu. Or you can get them off our various social media handles, but they're available for free. So again, don't worry about trying to get that information too quickly. So let's talk a little bit about gun violence exposure to start. And I will say, I consider myself, I am a clinical psychologist, and I consider myself a suicide researcher. So firearm suicide is really my life's work. It's where I feel like my expertise mostly is. But as the director of a gun violence research center, that expertise has had to broaden out a little bit. I talk a lot more about gun violence exposure more broadly and other types of gun violence. But the work in the first part of this presentation that talks about gun violence exposure and its impact on the physical and mental well-being of those impacted by gun violence. A lot of that work is led by Dr. Dan Semenza, who's an associate professor at Rutgers Camden and the director of research at the GVRC. And so I just want to make sure I give him props for his leadership in that space. So for this first slide, you can see this is a study about defensive gun use. Why am I leading off with that in this talk? For one very specific reason. When we hear the general national conversation about gun violence and firearm policy in the United States, a lot of those conversations are centered on the notion that the ability to defend yourself is pivotal and that it is common for folks to defend themselves with firearms, thereby necessitating firearm access and, in fact, necessitating deregulation of carrying firearms in sort of general community settings. And when we published this study in JAMA Open a month or two ago, the general reason we wanted to put it out there was to quantify exactly how common defensive gun use is amongst folks who have household firearm access and compare that to some less positive outcomes in their mind, which would be gun violence exposure. And so we had this nationally representative sample of American adults. And in this study, we looked at just the 3,000 folks who had household firearm access, so about 40% of the homes. And we found a couple of things. First of all, defensive gun use is exceedingly rare, actually. And amongst the folks who have household firearm access, gun violence exposure, in contrast, is actually very, very common. And keep in mind, in this study here, we didn't look at anybody who didn't have household firearm access, right? So 60% of American adults aren't even included in this. This is just amongst the folks who have firearms in their home. And you can see amongst those folks, almost 10% have witnessed a shooting in their neighborhood. Almost 20% have been threatened with a firearm in their lifetime. A little over 20% know someone who's been shot. More than 1 in 3 know someone who died by firearm suicide, and around half had heard gunshots in their neighborhood at some point in their life. Now, I do want to have a caveat on that variable, and it's going to come up once or twice, which is that hearing gunshots in your neighborhood or reporting that you have can mean that you heard, for instance, someone shooting at another person in your neighborhood. That'd be gun violence exposure. It could mean you heard a car backfire and you thought it was a gunshot. That would not be gun violence exposure. And you hear hunting during hunting season, right? So those categories wouldn't be gun violence exposure. So there's probably an element of overestimate on the heard gunshots. And I realize it says my internet connection is unstable, which is unfortunate. But when that happens, it tends to resolve very quickly. So I apologize if there's any um, audio or video issues on my end, and they should resolve quickly. So let's move forward. I mentioned Dan Semenza sort of leads our work in this space. And in this case, he led a study we published recently in one of the Lancet journals where we just wanted to quantify how common is gun violence exposure that's encountered in person and gun violence that's encountered through the media, just nationwide. That's not something that really had been done before. So again, using that same nationally representative sample of over 8,000 US adults, we looked at 6 different types of in-person gun violence exposure and 4 different types of media exposure to gun violence. And we found a few sort of key findings, one of which is almost 2/3 of adults in the US report having experienced some form of in-person gun violence exposure in their lifetime. Now, a large percentage of that is that heard gunshots variable that I was just talking about a minute ago. So is it really 2/3? No, it's probably lower than that when we're talking about true gun violence exposure, but not much lower. We also know that while all communities have sort of startlingly high levels of gun violence exposure, this is particularly true for Black adults and Hispanic adults. They have much higher rates of gun violence exposure relative to their white peers, particularly with respect to being shot, being threatened with a firearm, witnessing shootings in their neighborhood, and knowing someone who's been shot. And that lines up really well with gun violence data showing that these same communities are hit much harder by gun violence, injury, and death. The last sort of big component, and probably the most novel one from this, was that about 1 in 3 Americans report frequently seeing gun violence in the media, whether that's traditional media or social media. And this is particularly true for Black adults who were significantly higher than their peers to report substantial levels of media exposure to gun violence. Again, whether that means traditional media like the news that you see on TV, or whether that means social media. So people are encountering this both in person in their neighborhoods, but also sort of indirectly through the media that they consume. And one of the sort of missions for our center over the coming years is to better understand how this indirect media exposure of gun violence or to gun violence impacts the well-being of the folks doing that consumption. So I mentioned that there were highly elevated rates of gun violence exposure amongst Black adults and Hispanic adults. And so sort of related to that, a couple of years ago, we decided as a center to gather nationally representative samples of Black adults and American Indian Alaska Native adults. And the reason we chose these two communities is that, again, they are very disproportionately impacted by gun violence in terms of injury and death, and whether that means community violence or whether that means firearm suicide. But when people tend to study gun violence and its impact amongst Black adults or American Indian Alaska Native adults, it's usually from a large sample of predominantly white folks. And then you look at sort of the subgroup, this small subgroup of folks who identify as Black or American Indian Alaska Native. And we decided we want to do that. We wanted to have a sample that is explicitly designed to be representative of these particular communities to better understand their exposure. And so we looked at a lot of things in this study that aren't related to today's conversation: firearm access rates, how they store the firearms, do they carry them, and why. But if you look at the very bottom part of that center column, the last 4 things are the frequency with which both Black and American Indian Alaska Native adults have been threatened with a firearm, been shot, personally known someone who's been shot, and witnessed or heard about a shooting in their neighborhood. And so amongst Black adults, You had over 20% report having been threatened with a firearm, over 30% of American Indian, Alaska Native adults. You had almost 3% of Black adults reporting having been shot in their life, and actually slightly over 6% amongst American Indian, Alaska Native adults. Now, I will say that sample had just over 500 folks, which means that it doesn't take a lot to move those numbers. So that 6.2% is sort of I'd say, an unstable number. It's a high, what we can say with confidence is a higher than average percentage of American Indian, Alaska Native adults have been shot. It's probably not 6%, but it could be. It's within the margin. Now we have over 40% of Black adults personally knowing someone who'd been shot, and almost 40% of American Indian, Alaska Native adults. And you had almost 40% of Black adults having witnessed or heard a shooting in their neighborhood, and almost 1 in 3 American Indian, Alaska Native adults saying the same. So exceedingly high rates of in-person gun violence exposure amongst these communities, who again also have very high rates of firearm injury and death. So let's talk a little bit then about how frequency and recency of gun violence exposure relates to mental health and suicide. And so in this case, this is a study again led by Dr. Semenza and published this past year in Social Science and Medicine. And we found a few things that sort of stood out to me. And this again was in a nationally representative sample, that same sample of 8,000 adults gathered in May of 2024. And the things that stand out to me as sort of startling is, first of all, about 12% of all respondents had what we called high exposure to gun violence, meaning 5 or more incidents throughout their lives. So it's not just that they've exposed once, they've been exposed again and again and again, sometimes to the same form, sometimes to different forms of gun violence. And why that matters is we found that both the recency of gun violence exposure, but also the frequency and accumulation of types of gun violence exposure were all associated with elevated levels of depressive symptoms and with a greater propensity to report having thought about suicide in their lifetime or in recent months or within the past year. And so what this tells us is it's not just that these communities are encountering gun violence, seeing it, hearing it. It's not just that these communities are being injured or killed. It's that the folks who survive, it stays with them. It has really strong implications for their mood and for their tendency to think about suicide. So I want to give a couple of more studies on this, and then I want to give you sort of a general sort of take home on this. And I'm going to leave plenty of time for Q&A. We can talk about, what is it? Why is it that gun violence exposure increases these risks? Is it specific to gun violence? Is it violence in general? Is this just sort of, again, a sign of encountering stress increases the risk? And what I'd say is it's probably a little bit of both. I think there are aspects of this that are specific to gun violence, and there are aspects of this that are just sort of, when you encounter horrifically traumatic, upsetting things, you have traumatic, upsetting responses. Okay, a couple more studies. In this case, this is a study led by, again, Dan Semenza, and in conjunction with one of our former postdocs, Dr. Naja Baker, and wanting to understand not just the frequency of firearm violence or gun violence exposure amongst Black men and women, but to also understand how this impacts functional disability, your ability to sort of effectively conduct your sort of day-to-day living experiences, getting dressed, feeding yourself, drinking, getting to work, getting to school, the sort of day-to-day activities that allow you to function the way as you did prior to whatever sort of event happened. And what we found is that amongst Black men and women, gun violence exposure was in fact associated with substantial negative impacts on functional well-being. Now, why am I bringing this up when this is related? This is a talk about mental health. Well, because there's plenty of research out there separate from gun violence exposure showing that negative impacts on functional ability, functional daily life capacity has substantial impact, again, on things like depression and suicidal thoughts and behavior. And so one of the ways that gun violence exposure can impact mental health and suicidal thoughts can be when folks themselves are victims of gun violence and their functional well-being goes down. That functional well-being increases, it isolates folks. It creates financial problems. It creates a sense of burden amongst the people who themselves are functionally compromised in that way. And so it creates all sorts of paths towards people feeling the agony that leads to depression diagnoses and suicidal thoughts and behaviors. And here again, we were emphasizing this in a particular community, Black adults, that is really disproportionately impacted by all forms of gun violence. Following up again, taking that another level, that last one about functional health. Well, what about suicidal thoughts and behaviors? Well, we asked very similar questions again amongst Black adults, but we focused in on suicidal thoughts. And one of the reasons why is that while the rate of suicidal or suicide death amongst uh, uh, Black adults and also Black children is lower than in their white peers, particularly amongst young Black men, the rate has increased startlingly in recent years. So there's been a real surge in the suicide death rate amongst young Black men. And so we want to look at the extent to which gun violence exposure could be associated with that suicide rate. Not explaining the whole thing. There's lots of things that feed into that, but to what extent might this impact things? And what we found, maybe unsurprisingly, is that not only are individual types of gun violence exposure associated with all of these lifetime suicidal outcomes, and what I mean by that, lifetime suicidal thoughts, lifetime preparations for a suicide attempt. That can mean acquiring methods, writing a suicide note, giving away belongings, also attempted suicide. So each individual type of gun violence exposure was associated with these outcomes, and cumulative exposure was as well. Again, so exposure to multiple types of gun violence was also associated with these outcomes. And so both just the sort of individual experience of an incident of gun violence, but also the accumulation of incidents and the diversity of those types of incidents over the course of a lifetime have a sort of profound effect on an individual's mental well-being. Couple more, actually just one more, and then I want to sort of do a big sort of summary and my pivot and keep an eye on the clock to make sure I'm leaving time for Q&A. But we're going to pivot over to firearm suicide in just a minute. So the last study I wanted to talk about, again, was Dr. Semenza in collaboration with some of our colleagues at other institutions. And in this case, we're actually curious also about the mental health impact of sort of indirect or secondary homicide survival. Most homicides are firearm deaths, not all, but most. But what we found is that folks who lose someone else to homicide themselves in the subsequent 12 months are at greater risk for a mental health diagnosis. And this is particularly true amongst young individuals who lose someone to homicide. So another way that gun violence can impact someone is not just if you yourself are exposed, right? But if your community, your support network, your family is impacted by this, and you suffer a loss. So what's the general summary? I just fed a lot of data to you, a lot of different studies. First of all, gun violence exposure is frighteningly common, extremely common across communities, but particularly amongst Black adults and Hispanic adults. At least when we're talking about community violence. When we talk about firearm suicide, those numbers flip. And it's particularly true amongst white adults. We also know that those exposed to gun violence in its many forms have higher levels of depressive symptoms and greater propensity to have encountered or experienced suicidal thoughts. That all being said, gun violence exposure is not the only path to risk that's directly related to firearms. The other path that's really important to be thinking about is firearm access, particularly when firearms are stored unsecured in and around a home. That firearm access, particularly unsecured firearm access, is the single greatest risk factor for death by suicide in the United States, and it's not even close. So I'm going to give you some data on that, give you a little bit more clarity about why I say that. But I just want to emphasize again, there is no risk factor for suicide that compares to household firearm access. So let's put some numbers behind that. In 2022, there was just south of 50,000 suicide deaths in the United States. 55% of those deaths were by a single method, which is self-inflicted gunshot wound. And that's true despite the fact that firearms were used in less than 5% of suicide attempts in the United States. So let me put that in a different way that I think drives the point home. If someone in the United States attempts suicide, they almost never use a firearm. And yet, if someone in the United States dies by suicide, more often than not, they died using a firearm. That stat shouldn't happen. If this method's almost never used in attempts, it shouldn't account for more than half the deaths, but in fact it does. Firearm suicide on its own is a top 15 cause of death in the United States. It's about 25,000 folks dying every single year by suicide by this single method. There's more firearm suicides than there are other suicides by all other methods combined. There's more firearm suicides than there are homicides by all methods combined in the United States. The magnitude of this problem is understated and not often understood. And the reason why this is true is because firearms are uniquely deadly. So around 90 to 95% of the time that somebody uses a firearm in a suicide attempt, they die. Less than 5% of all other suicide attempts in aggregate across methods result in death. Now, it's a little bit misleading. So if you look at something like hanging, it has a higher lethality rate than that. It still doesn't compare to firearms. But if you look at the most common suicide attempt method in the United States, which is intentional overdose, it's more than half of the known suicide attempts in the US, that has about a 2 to 3% case fatality rate. So 97 to 98% of the time that somebody attempts suicide using overdose, they survive. Only about 5 to 10% of the time that somebody uses a firearm in a suicide attempt, they survive. And we're going to come back to that point in a minute, in a couple of slides from now, to highlight why that's so particularly important. But it's the sheer deadliness of firearms that make them so central to the story of suicide in the United States. And I also want to emphasize that as high as that 55% number is, some communities see it even higher. So where I lived before, Mississippi, is where I've done most of my professional career and where I started doing this work, that's about 70% of all the deaths, suicide deaths in that state result from self-inflicted gunshot wounds. And that same number, 70%, applies to service members and veterans. Really, any community that has a particularly high rate of firearm access, firearm ownership, has a high rate of firearm suicide and subsequently a higher rate of overall suicide, because where the firearm suicide rate goes up, the overall suicide rate goes up. So in New Jersey, where you have about 15% of households, sometimes slightly higher, reporting household access to firearms, only about 25% of the suicide deaths in this state result from self-inflicted gunshot wounds, and as a result, our overall suicide rate is a lot lower than you see in other states. We know that suicide, death by suicide, is 3 to 5 times more common in homes where there's a firearm. And that's true for all folks in the home, not just the person who considers him or herself the firearm owner. This is about access, not ownership. We know that risk for death by suicide surges in the year following the purchase of a firearm, particularly handguns. But the median number of years that pass between purchasing a firearm and using it in your suicide death is 11 years, which means that when we think about interventions, there's a lot of value in interventions that focus on trying to prevent high-risk people from purchasing firearms. But if we put all of our energy there, we're going to miss most the people who need our help. And in fact, another way of thinking about that is that the vast majority of firearms that will be used in suicide deaths in the US over the next 5 to 10 years are already in people's homes. So when we're thinking about solutions, we have to think about, how can I reduce risk in a home that has a firearm when I don't know which homes have firearms? And as I'm going to tell you in a few slides, we also often don't know who's thinking about suicide. It makes it a hard problem to solve, but one that I promise that we can. Really importantly, though, risk for firearm suicide, risk for suicide overall, goes up beyond the simple risk from home access if that firearm is stored unsecured. And that can mean a lot of different things. And some people say safe storage. The reason I say secure storage, and the field has moved that way, is that if the most common reason people own at least one of their firearms is home safety. I have a firearm in case somebody's going to break into my home in the middle of the night, wishing to do me or my loved ones harm, and I need to be able to access it to keep myself safe. And if I ask that person, well, is your firearm stored safely? They might say, yeah, I've got it loaded under my pillow in case someone breaks into my home. Because from their perspective, the firearm is a tool for home protection. And so safety means sort of staging that firearm in such a way that it can serve that function in the most effective, efficient way possible. But obviously, from the suicide prevention perspective, a loaded firearm kept under your pillow, it's not safe at all, right? And so what I mean by safe and what someone else means by safe might not only be inconsistent, it might be incompatible with one another. But when we talk about security, that tends to get past that boundary. And so from a suicide prevention perspective, when I'm talking about storing a firearm securely, we don't have data saying this one method or number of methods or combo of methods bestows the greatest level of protection. We think of it as a continuum, but the things I tend to encourage are storing the firearm unloaded, separate from ammo, so not within arm's reach. You can't just pick up the magazine, put it in the handgun, and it's loaded. So out of reach of the firearm and locked up. Whether that means the firearm is stored in a locked container like a gun safe or a lockbox or a gun cabinet or a Pelican case, or whether that means a locking device is stored on the firearm. That can mean a cable lock or trigger lock or a clamshell case or a variety of others. And I'll give a visual towards the end of some examples of these, and I'm happy to talk about this more as we go. But I mentioned I would come back to the lethality of firearm suicide, and that's what I'm going to do here. A lot of people have heard the stat that when someone survives a suicide attempt, 90% of those folks never go on to die by suicide. And I love that stat. It's very sort of hope inspiring, but I actually think the stat above it is more important. It comes from the same study. And that's that 70% of folks who survive a suicide attempt never even attempt again. And so what that tells you is that second chances are a really, really big deal. But the problem is that folks who use a firearm in their suicide attempt, because they're so uniquely deadly, almost never get a second chance. They don't get to be a part of that 70%. So the method isn't the only thing that matters, right? I'm not interested in lowering the firearm suicide rate while the overall firearm suicide rate stays the same. There's nothing noble about changing the way people die, right? Firearm suicides are not more tragic than other suicide deaths, but firearm suicide attempts cause a much higher rate of suicide death, and they increase the suicide rate. And so focusing on this method and reducing the likelihood that someone attempts using a firearm is going to lower the overall suicide rate. It's going to increase the odds that that person never dies by suicide by any method, in fact, never even attempts. So what do we do? Well, the reason I focus in on the method, I gave you some justification there just in terms of the sheer frequency that this specific method is used and the variation in the deadliness of the methods makes it not the only thing that matters, but something that matters. But I want to highlight here through 3 different anecdotes is that there is only one tool historically that has ever been shown to reduce the suicide rate in a particular community meaningfully and sustainably. There's all sorts of evidence-based treatments. Again, as a psychologist, I love mental health treatment, right? That data-driven treatments, I'm here for it. I'm going to talk about an intervention that my team is working on a lot in a few minutes. But any sort of one-on-one intervention tends to fail in terms of lowering the suicide rate. The only thing that has done this is what used to be called means restriction, but we now refer to as means safety. A means safety means taking a method for suicide and either making it less deadly or making it less available for an attempt. And quite frankly, means safety works for all sorts of other things, right? So needle exchange programs are a means safety approach that helped reduce new HIV transmissions in the 90s. Seatbelts are a form of means safety to reduce auto fatalities, right? So anything that can make the thing that's causing the negative outcome less likely to cause it, when you're manipulating the actual tools or items that cause that negative outcome, that's means safety. But let's talk about this in suicide perspective. Now, I'm going to talk about 3 different methods, and this first method is actually an anecdote of a specific person. I'm not talking about this to sensationalize something. This is not a graphic story, but just as a heads up that I'm going to talk about the suicide death of Sylvia Plath. You see in the bottom right-hand corner of your screen, famed novelist and poet who was living in the UK at her time of death by suicide in the mid 20th century. And she died by suicide using the method that at the time was the most common method in the United Kingdom. That's sticking your head in the oven. And if you haven't heard that, a lot of people are sort of taken aback. Why, I've never heard of that. And there's a reason. It's not something that happens very often anymore. But it's important that people were not burning themselves to death. At that time, the domestic gas supply in the UK was so heavily inundated with carbon monoxide that people very, very quickly suffocated to death. And so it was a very common method for suicide there because it was highly lethal and readily available. And means safety really only works effectively if you're focusing on a method that is used commonly in the specific geographic space and has a high lethality rate. And so that was the case here. So for reasons unrelated to suicide prevention, the UK government, not actually all that long after, about within a decade or so of Sylvia Plath's death, they detoxified the domestic gas supply. And in doing so, what you saw was a 90% decrease in suicide deaths by that method. while all other methods stayed stable, resulting in around a 30% reduction in the suicide rate in the UK that stayed down sustainably for a substantial period of time. So a massive and sustained reduction in the overall suicide rate in the UK by taking the most commonly used highly lethal method and making it less plausible to use as an attempt. People didn't just start dying by other methods. Some did, but overall what you saw was that people just died by suicide a lot less often. If you look at the left-hand side of your screen, you see a farmer in Sri Lanka. And around the turn of the 21st century, they were having a real problem in Sri Lanka with farmers ingesting pesticides and dying by suicide. They tried a number of things, including secure storage, which didn't work for that. But ultimately, what they did was they banned the most lethal brands of pesticide in Sri Lanka. And following that ban, the overall suicide rate in Sri Lanka, not the pesticide suicide rate, the overall suicide rate in Sri Lanka went down by 50%, half the suicide deaths gone. Look at the upper right-hand corner of your screen. The example most relevant to this particular presentation, you see a young service member in the Israeli Defense Force, the IDF. And in Israel, there's very minimal private firearm ownership, but there is mandatory compulsory military service for young citizens. And again, around the turn of the 21st century, they were having a hard time with young service members dying by suicide using their service weapons. And so they just changed their policy around. They said that if you go home on weekend or holiday, you have to check your service weapon into the armory. Following that policy change, the suicide rate amongst those young service members went down by 40%. So again, in these three examples, which are not the only examples, but they're compelling ones, I think, you see a frequently used highly lethal method for a particular geographic space altered in a way that made it less deadly or less available for a suicide attempt, and then a massive and sustained drop in the suicide rate in that community. So in the United States, what's the frequently used highly lethal method? It's firearms, right? Again, that's 55% of our deaths in any given year. But we're not going to ban firearms in the United States. That's not going to happen. Even if we suddenly woke up today as a country and said, you know what, no more Second Amendment, guys. We don't want that anymore. Well, there's 400 million firearms in the United States right now. What are we going to do with them? We don't even know where they are. There's 100 million more firearms than there are people in the United States. So when I think about solutions to this problem, I'm much more interested in threat mitigation than I am in sort of policy discussions that don't address the reality of the situation that we're in. There are a lot of people who need help, and they will not be helped by solutions that can't actually be implemented. That doesn't mean there isn't room for a conversation about Second Amendment stuff, of course not. But it means that as a suicide prevention focused individual, my job is to try to save as many lives as possible and to focus on solutions that can do that right now. And so that's what I think about here. And so that to me translates to secure storage. And I already gave you some of this information earlier about what that can mean. I just want to highlight also two things that I didn't mention. One is that there's a lot of idiosyncratic options for secure storage in the home if people don't like the traditional ones, and we can talk about that during Q&A if you want. But there's lots of ways to do this. And there's ways around, like in New Jersey or in Mississippi, you can let someone hold your firearm for you, and that's fine. In New Jersey, you can't do that. That's a felony. You can't just transfer a firearm without a background check. But you can disassemble a firearm, take out the firing pin, and have someone hold the firing pin. That renders the firearm inoperable, but it isn't a transfer of a firearm, it's a transfer of a firing pin. So there are ways to get around sort of the local legal difficulties of this. But that leads into the second thing that I didn't mention before, is that while a securely stored firearm in the home is safer than an unsecurely stored firearm in the home, it's still more dangerous than one that isn't there at all. So we also encourage folks to think about legally, voluntarily, and temporarily storing firearms outside of home during times of crisis, just like you let somebody hold your keys if you've had too much to drink, then you go and get them back. And we can talk about in the end all sorts of different ways that we are trying to encourage that, some policies that we're trying to work with some New Jersey elected officials to get passed that will facilitate making that easier. And I'm going to show you a tool that we created as a center to help facilitate this in New Jersey. So here I am talking about secure storage as this incredibly important firearm suicide prevention tool. And so the question then is, well, do people do it? And what we found is no, actually, as you can see on the left-hand side of this study, this national sample we studied led by a colleague of mine, Dr. Emmy Betts, published in Annals of Internal Medicine a couple of years back. About 2/3 of folks with firearms store at least one firearm unlocked, just sort of generally by default. So most homes, people don't. And we've done all sorts of follow-up studies that show people don't do this because they don't believe it's helpful. It's not relevant to anything. And in fact, that it will create difficulties in trying to have the firearm serve the function they believe it'll serve, which is home defense. And there's lots more information I can get into here with you guys later about what types of storage devices people want, what do they prioritize, to what extent would people be open to coupon programs, or you discount the more expensive ones. We have all sorts of information on that. That's just getting a little bit more into the weeds than I planned for today. But so the question then becomes, well, what do we do if we can't ban the firearms? And a lot of people don't believe in secure firearm storage as something they should do on a day-to-day basis, and they're not aware of or not open to out-of-home storage. What do we do? Well, I would say we have to go where the risk is, and we have to speak persuasively. But as you're going to see over the next couple of slides, going where the risk is, it's kind of hard. We don't always know where it is. So what that means to me is that we have to speak persuasively from a primary prevention perspective. And so I've really, I when I was at Southern Miss as a faculty member, I was in the clinical psych program. I think of myself, identify as a clinical psychologist, but when I came to Rutgers, I'm in public health. And my perspective on this has really shifted to a public health lens, which is to say that I can't always wait for someone to come and tell me that they're having a hard time, direct them to evidence-based care and solve the problem that way. When that does happen, that's a great thing to do. But I just can't wait for that, because as you're going to see in a minute, that's just not the scenario that unfolds very often. So I need to think about, how can I get the message out persuasively to everybody without knowing their level of risk? Because if I have to know the level of risk, I'm never going to get there. I'm never going to find it. I'm never going to be able to direct my message where it's supposed to go. I'm just not going to have that information. So I need to find ways to embed this information, this perspective into the community without waiting to know when someone's at their greatest moment of risk. And so one of the things that makes this hard, and this is a study published in JAMA Open by the new Dr. Ali Bond, who is joining our center as an assistant professor in the fall and had previously been a doc student with me in my lab. And she looked at about 15 years of data from the National Violent Death Reporting System, NVDRS, so about almost 250,000 folks who died by suicide over that span. And she compared folks who died by suicide using a firearm to folks who died by other methods, and found a couple of things. One, replicated something we'd found before, just that folks who died by suicide using a firearm are less likely to have survived other attempts by any method previously. So about 90% of folks who die by suicide using a firearm die in their first ever suicide attempt, meaning they didn't survive another attempt and get on our radar as high risk and then eventually die. No, they died in the first time they ever tried. But she also found that folks who die by firearm suicide are less likely than folks who die by suicide using other methods to have been in mental health care at the time of their death or at any other time in their life. So when I was saying a moment ago, I can't just wait for people to come and talk to me, that's because they don't. If they're vulnerable to firearm suicide, they are highly unlikely to seek out mental health care. And so if our suicide prevention system is designed around infusing our mental health care system with the best tools, look, again, that's a great thing to do. We need our best tools in the mental health care system, but that's not going to solve the problem of firearm suicide, because you've got these great tools over here in this system, and you've got everybody who needs them over here. And these two groups don't meet. And so these tools over here don't help these folks, right? It doesn't matter how good and effective these tools are if these folks never see them, and they aren't seeing them. Let's take this a level further. A friend of mine, Craig Bryan, who himself was a service member and was deployed to Iraq, let me sort of ride his coattails on a study a handful of years ago, where he had a massive study, a massive sample of service members and veterans in primary care. And he found one good thing and one really not so good thing. The good thing was that suicidal service members and veterans were less likely to have a firearm in their homes. So that's good, right? The folks thinking about suicide were less likely to have a firearm at home, meaning their environmental risk was lower, even as they were contemplating suicide. I love that. It's good. However, when suicidal service members and veterans had a firearm in the home, they were more likely than any other people with firearm access to store the firearm unsecured, which in this case meant both loaded and unlocked. That I don't like a lot. So the folks at the highest risk, they were suicidal and they had home firearm access, were the ones most likely to store their firearm in the most readily accessible manner possible, meaning that the risk for suicide death is just astronomically higher. But when you find something scary like that you've never seen before, it's important to tap the brakes a little bit and be like, well, maybe there's something about the sample. Or is this really going to replicate? So we tested that a couple of years later in a massive sample of National Guardsmen and found the exact same thing. So we are pretty confident this is real. But it gets a little bit worse, but only for one more slide. Then I'm going to pivot to what can you do about this and sort of wrap things up and leave time for Q&A. So we, a couple of years back, at a study funded by the DoD, and we had a nationally representative sample of firearm owning service members across active duty and guardsmen and reservists. And so in this case, in our sample, everybody was a service member, everybody had a firearm. But then we narrowed it down even further. We only looked at folks who reported that they had suicidal thoughts in the past year or the past month. And we asked them a couple of things. We said, hey, have you ever told anyone about your suicidal thoughts? And B, have you attended any mental health care or behavioral health care sessions in the last few months? And what we found is that the folks who had hidden their suicidal thoughts, never told anyone about them, and folks who had not attended recent mental health care sessions were more likely to store their firearms unsecured. So the take home from those last 3 studies is that the folks who most need help, the folks most vulnerable to firearm suicide, are the ones who are not seeking out mental health care, and in fact are often hiding their suicidal thoughts. And this is why the story of American suicide so often involves family members, loved ones, friends saying, I never saw it coming. And the reason they never saw it coming wasn't because they weren't attentive. It wasn't because they did something wrong or didn't care or were too wrapped up in their own life. No, it wasn't their fault. It's that we can't see into people's minds, and agony isn't always obvious. And so sometimes the first sign of risk is that somebody died. And when firearms involved and they attempt suicide, they're almost certainly going to die, which means we need tools that change the environment so that those who are struggling silently, scattered randomly across our community, are less likely to be able to quickly reach for a loaded firearm and use that in a suicide attempt. So what are our tools? One of the tools is an intervention called Project Safeguard. Now, I didn't include my slides on public health messaging, and we can talk about how we can sort of leverage things like we did for drunk driving with Friends Don't Let Friends Drive Drunk, and all the work we're doing on effective, trusted messengers and mediums through which to deliver those things. I sort of left that out for today to leave space for Q&A, but I want to talk about Project Safeguard. This is a lethal means counseling intervention developed in collaboration with, again, my buddy Craig Bryan. And we did a randomized controlled trial. I was still down at Southern Miss, looking at 232 firearm owning members of the Mississippi National Guard, and we randomized them to 1 of 4 conditions. They get Project Safeguard, our 10 to 15 minute lethal means counseling intervention, or they get that plus free cable locks for each of their personal firearms, up to 10 of them, or they get randomized to our health and stress control condition, or randomized to that control condition, again, plus the cable locks. And so the active interventions were Project Safeguard and provision of cable locks, looking at their combo. Folks then came back 3 months later and 6 months later, and then after the 6 month session were offered any intervention they didn't get at baseline. And what we found, well, and first of all, you did not have to be suicidal to be involved in this. Some folks were, they could come in, but we want to make sure this works regardless of suicide risk for all the reasons I just laid out for you. If I know this only works amongst people who say, hey, I'm having thoughts of suicide, then this doesn't work. I need this to work regardless of known risk. And so these were largely folks coming in, not wanting to talk to us about their guns, not feeling suicidal, and we still had to convince them to store their firearms securely through one single 10-minute conversation, and then see if that change was sustained months later. Now, the approach we use is based on the principles of motivational interviewing. I can't give you a whole MI background on this, but the basic principles of MI are respecting someone's worth, looking at things through their lens, their perspective, respecting their autonomy, affirming their perspectives and opinions, inviting them through open-ended questions to share their perspectives and work collaboratively. So in MI, you cannot argue with someone. In MI, you are not a wizard who tells someone to change and bestows change desire upon them. You're more like a personal trainer, working to leverage someone's own intrinsic motivation to change and rolling with the resistance that comes when people are naturally ambivalent about changing a behavior. So we used that approach. And what did we find? Well, a couple of things. First of all, actually, I'll put this slide up first. Substantial changes. Now, the combo of Project Safeguard and provision of cable locks wasn't better than either intervention on their own. But the folks who had the Project Safeguard conversation were 40% more likely to secure their firearms. And that was maintained 6 months later. So a single 10, 15-minute conversation prompted at least a half a year of improved secure storage. The folks who received cable locks were twice as likely to start locking up their firearms after we provided them, and oftentimes showed them how to use them effectively. So also importantly, though, is that we retained over 90% of our samples. We weren't alienating people and people were just leaving. And 100% of the folks who received Project Safeguard or a cable lock said they'd recommend the intervention to appear. The only person who said they wouldn't recommend it received the control condition. And then we gave them Project Safeguard and cable locks after that. So it was very effective. Now, did it work for everyone? No. And so for that reason, we are um, adapting the intervention. We have an online RCT funded by the DoD, um, where we're testing an online version of this, and we're preceding it with a intervention that lowers folks' intolerance of uncertainty, so they're less sort of stressed about their environment before we do this, and see if that makes the response better. We are actually rolling this intervention out nationally across the National Guard and training the National Guard as trainers so it can become a sustainable part of their primary prevention intervention. So we're starting in New Mexico in a couple weeks, and then Oregon a few weeks after that. We're going around the country and training the entire National Guard in Project Safeguard, which we are thrilled about. We also had some money from the state and have been working on trying to train faith leaders and barbers across the state of New Jersey. So the idea is, let's get this tool into the hands of trusted community members who talk to folks about sensitive issues but aren't seen as political agents on firearm related topics. Okay, couple quick tools, and then I want to stop and leave us a good 10 minutes of Q&A. So when I talk about in-home storage options, there are a lot of options. Cable locks, which you see in sort of the middle, the red lock is the most commonly distributed one. I will say most people use them as bike locks, and when they do use them on their gun, they often use it incorrectly. And also people tend to hate them. They would much rather have gun safes or lock boxes. But the viability of giving everybody a gun safe is it's financially questionable. And so cable locks are certainly better than nothing. Out of home options, you have to be aware of the laws around transfers of firearms in your state. But in New Jersey, FFLs, firearm retailers, are a very good option, and there are a number of them willing to consider this on a case-by-case basis. We're also bringing up a intervention called the Armory Project. We're going to hopefully be working with the folks who created in Louisiana and bringing it to New Jersey, which is really sort of a firearm community-led initiative that promotes out-of-home firearm storage during times of suicide risk, led particularly by veterans. But here you can see the New Jersey firearm storage map. We have, I can't remember, 25 or so retailers who agree to be listed across the state to consider on a case-by-case basis storing folks' firearms for them temporarily. So it's not a guarantee. There are gaps in the map, but it's certainly better than nothing. And so if you need to direct someone to something to try and figure out where they can store their firearm, this is an option. You can find it on the GVRC's website. You can use the QR code on this slide. And the last thing I want to leave you with is just, look, if you appreciate the research we're doing here and you find this important, you should be aware it's not just the federal government that's threatening funding on science in general and gun violence science in particular. Governor Murphy proposed to slash the GVRC's budget by $1 million in the upcoming fiscal year budget. That will be catastrophic to the work that we do. It's just catastrophic. It's also unnecessary. There's a $6.3 billion surplus. So if you restore our funding, there will then be a $6.3 billion surplus. It will have zero impact on the budget. So this is a very strange and wildly inconsistent proposal. We are cautiously optimistic that we've got enough support from the legislature to have the funding restored over the next couple of weeks. But it's not certain by any stretch. And so if you find that problematic, I would not be the least bit offended if you were to reach out to your elected officials and tell them so. So thank you for your time. Thanks to all the GVRC folks who help in all of this work. If you want to reach me, you see my email and my social media tag. You also see the GVRCs. And I'm looking forward to about 10 minutes of Q&A with you folks. I'm going to go ahead and stop my share so that we can chat.
Okay. Does anybody have questions? And I noticed no one put any questions in the Q&A box. So I'll give you a few minutes if you have any questions, please add that there. But I do have a couple of questions, Dr. Anestis. How might public health interventions address the relationship between gun violence exposure and suicide risks? And what are some of, I'm sorry, and what are, this is a two-part question. And what are some of the interventions your team, I think you probably mentioned this, but are currently working on? Now this goes into safety. How does it build on the concept of mean safety?
Yeah, sure. So in terms of public health interventions, there's a lot of things that can be done. So one of the things that's been really successful in helping the rates of shootings go down across New Jersey cities and cities outside of New Jersey have been sort of public health approaches, things like community violence interruption groups, hospital-based violence interruption programs. They have had really great success in New Jersey and beyond. And those programs often leverage the perspective and expertise of folks who themselves have experienced gun violence, either as victims or perpetrators of it. um, who understand the dynamics of the very small percentage of the community that tends to be actually involved in the shootings, um, and have worked really well to reduce shootings in those cities. And so by reducing the shootings, obviously you're going to reduce the sort of mental health impact of gun violence exposure, because there's less gun violence to be exposed to, right? And so there's a lot of sort of positives there. In the hospital-based violence programs, that's when someone gets shot in the hospital, they then get sort of connected to all sorts of resources to sort of stop the sort of feedback loop of retribution that often happens when two groups have sort of beef with one another. And so you sort of stop that cycle that way by getting people connected to resources that help them sort of get outside of that conflict. There's also good data on things like what's called greening, taking specific neighborhoods impacted by gun violence and cleaning them up, putting park space in there, and lighting them better, and that those interventions themselves actually increase the safety and the foot traffic involved in those places in the neighborhood, and that can reduce the burden. So on the community shooting side of things, there's lots of public health stuff that can go on. On the firearm suicide, I mentioned Project Safeguard, lethal means counseling, as a big thing. But another thing that I didn't talk about, I just sort of referenced, again, is messaging, right? So much of this is that the firearm industry had a really sort of 30-year head start where they shifted from marketing firearms as tools for hunting to tools to keep you safe in an unsafe world. And we have internalized this so much, though, that if you look at popular media, the way we present firearms reinforces that narrative. So people have come to honestly believe through trusted sources that they need to have a firearm to keep themselves and their loved ones safe. And it's totally reasonable to want to keep yourself safe and your loved ones safe, right? And so the message that I'm selling here falls flat because I'm not a trusted resource, and I'm coming in after 30 years of something else, having a chance to really internalize. And so public health messaging is another approach, getting the data into the hands of trusted voices and then spread throughout the community so that people encounter it enough times that they start to think about it differently. And we've seen that happen rapidly with things like shifts on the perspective of marriage equality. We've seen that happen more slowly, but still effectively on things like our perspectives on drunk driving. In the 80s, people were super permissive about drunk driving, and designated drivers sounded ridiculous. It sounds like a moral imperative now, right? And so we have to do the work of creating the demand for secure storage. And that comes through shifting social norms.
Yeah, that's great. Thank you so much for that feedback. Really great. So we have another question here. Well, also to let you know that the presentation was really good. Great. For those who have a gun for gun safety and feel compelled to have it accessible, how do you suggest to address their fear of threat versus actual risk of unintentional injury by firearms?
Yeah. So the first thing I'd say is don't argue with them, right? So don't come in and be like, no, let me tell you the actual straight on. You can ask, hey, do you mind if I tell you some numbers? But what we found is the numbers don't tend to move people very much on this. And so what we tend to do is hear and validate their perspective. So in MI, you would say something like, oh, it sounds like safety is really important to you. You can ask, hey, what do your friends and family members do? Did anybody else do something differently? Why do you think they do it that way? For some folks, they are not ready to change, and you won't force that. But you might be able to explore, well, are there scenarios where you might? What if there are kids over? What if you weren't feeling like yourself? What if you're feeling depressed? And would you consider things differently then? And so to give you a really quick anecdote, at the beginning of Project Safeguard, we had a guy come in, and the clinician who was doing this was a doc student's or first clinical experience. He thought she flew. She did a great job. But the guy came in and said, this is ridiculous. I'm not gonna do any of this. Like, why are you even talking about this? We thought we wouldn't see him again, but the clinician very skillfully validated his perspective, explored possibilities, sounded like nothing was going to take, but whatever, didn't fight him on it. Surprisingly, he came back at his 3-month appointment and he said, you know what? This is ridiculous. I'm still not doing it, but I will accept my payment. Thank you. So we said, hey, hey, thanks for your honesty. We don't want to just be sold sort of a line. Like it's helpful to understand your perspective. So another conversation about how you might think about things differently in the future, but maybe you won't. Maybe this isn't for you. Came back at a 6-month appointment. And he said, look, since the last time I talked to you, I broke up with my fiance. Thought about the conversation we had 6 months ago. I let my brother hold my guns. This guy had 7 of them. And I'm pretty sure I'd be dead if I hadn't done that. And so he was empowered to save his own life when it became salient to him after having had a conversation that maybe made him think about it a little bit differently, but didn't force the issue on him in that moment. Most of the time when you're talking about folks, they aren't in a world on fire moment. And so it doesn't feel salient. It doesn't feel real. Suicide happens to someone else, but anybody could have their house broken into. So I need to protect against that. That's the real threat. We know statistically it's not, but that doesn't change anyone's perspective. But equipping them with the idea to think about what might change so that when they feel differently, they maybe think about it differently. That's going to get them to save their own life.
Right, right. That's great. Thank you. We have a lot of great questions coming in. What is the experience with mental health assessments at the point of gun purchase? Are there assessments that can be done on the sales side that reduce later use of gun in suicide?
I have some skepticism about that. So for the same, like the ability of the best experts to assess suicide risk is bad, right? We're the slightly better. If you look at the terrifying study by Joe Franklin, we're slightly better at chance than chance at predicting who's going to die by suicide in the future. So putting that, especially through like a self-report questionnaire, into the hands of firearm retailers, I think puts a huge unrealistic burden on them and likely yields a screening tool that's just not very accurate, right? And in a conversation that's so much about balancing rights and autonomy, if you say you have to come in and fill out personal information and based off that, I'm going to take away your rights, oh man, is that going to explode, right? It's just not viable, I think. I do like the idea of screening for firearm access in healthcare settings. I do like, if you're not comfortable doing that, talking about secure storage anyways. And there are tools available. If you look at Lock to Live, so the word lock, number 2, live.org, MBET's created a tool that's been studied through a couple of trials that can be done autonomously in someone's smartphone to figure out how to keep their environment safe. This one does firearms and medicine, but you can encourage folks in healthcare settings to just, hey, you should think about this. I don't know if you have, I just assume you have a firearm at home. So here's something to think about how you store firearms. So I think that we don't have accurate enough screening to implement that at the firearm purchasing stage. There's even questions about whether universal screening for suicide risk in the healthcare setting actually yields positive results. And I've seen some compelling data that doesn't. But promoting secure storage universally in all sorts of settings can, I think, be beneficial.
Okay, we have time for one more question, and then we have some other uh, information that folks provided, and I can share that with you at the end, Dr. Anestis.
Yeah,
But,
thanks.
thanks for the session, and you hinted at this, but can you share briefly on how you encourage persons to store firearms safely while satisfying their desire to have quick access to family and home safety?
Absolutely. So you work within their value system, right? And so some people aren't comfortable with much of anything. And so we talk about what they'll do hypothetically in the future. Some folks, they're comfortable with, for instance, a biometric safer lockbox. It's programmed only to a certain set of fingerprints or a couple of fingerprints. So you can open it very quickly. Some folks are scared that technology will fail though, or they find they're too expensive. And so it varies, right? But you talk to someone about like, well, what does sound reasonable? Like what would be a hard no because it feels like it makes it too inaccessible in emergency? What would work? Would you be willing to put it in a safe, but keep it loaded still? So you don't, we created one barrier. Does that make sense, right? And different people are open to different things. I think, you know, while I wish we had better data to know which method is most effective, not having that in some ways frees me up to just say, look, I don't know. Safety is a continuum and we all live different lives with different perspectives. So let me understand yours and let's figure out what from this menu of options makes sense for now. And I think what we find is sort of like inertia. Once people start moving, it's easier for them to keep moving further. But that only tends to work if they initiate that movement on their own.
Got it. Got it. Well, this was great. Unfortunately, we can't get through all of the questions. And I do have, the feedback that the participants shared in the Q&A, and I can share that with you. But I just want to say thank you so much for providing this important information. A lot of great data and information here. I did share the presentation with you all. I will share that again at the end of this webinar. But Dr. Nestis, thank you again. Thank you for all the work that you and your team is doing. This is a really, really great information. And we just need to continue to push for this as it continues to be a public health issue in this country. So thank you so much again. And I'm going to share the evaluation link. And I will share those slides again for those who logged on at a later time. But again, Dr. Nessis, thank you. You don't have to stay on. I usually just stay on for a little bit so that way they get the evaluation. But
All right.
I really appreciate it. Thank you for your time.
Thank you so much, everybody. I appreciate it. Sorry I didn't get to all the questions. Okay. Bye, folks.
Take care. Thank you. Again, everyone, I am going to log off in a few minutes. I will share the uh, webinar presentation with you, and I would share the evaluation link. Just know that please complete the evaluation. That way you can receive whether it's public health, your CHES, or nursing credits. Again, thank you all for joining the webinar today. This is being recorded. I will update it and upload it to our YouTube channel at the end of the week. I know some of you asked about that, so you can share with your colleagues. But thank you again. Take care, everyone, and please look out for our next upcoming webinar. Have a good one.